Hello, I'm Dr. Nina Kramer, and in today's video, we're going to talk about what is a dental implant. A dental implant is a replacement option for a missing tooth. It's a titanium post that mimics the root, and it's actually a three-part system. So you have your dental implant and the bone, and then an abutment that attaches to the implant and holds on your crown. This looks and feels like a natural tooth.
So once this tooth root substitute is placed in the gums by a dental surgeon, a prosthodontist or a restorative dentist will then make a new tooth or a restoration to be placed on that implant. And it'll fit together to the implant like a puzzle piece. Patients who are missing all of their teeth in one arch, a prosthodontist may recommend a full arch of restorations being anchored by implants. So in this case, the dental surgeon can place as few as 4 implants in the gums, and then the prosthodontist can make a full bridge that will connect to all 4 of those implants, and that will truly restore a patient's smile.
I often get asked the question, am I a candidate for dental implants? And the answer is anyone who's missing 1 or more teeth and has healthy jaw bones is a candidate for dental implants. Sometimes it's necessary to perform bone grafting to rebuild lost bone and ensure that we have a healthy jawbone to place a dental implant. What if you were told in the past that you're not a candidate for dental implants? How do you know that this is true? Well, here's Dr. Davis to answer that question for you.
One of the most common questions I get from patients is, am I a dental implant candidate? Fortunately, the great majority of patients that we see are in fact dental implant candidates. However, this cannot be determined until we do a very thorough medical history, very thorough dental history of your past dental history, and then of course, what it is that you want and desire so that we can help you attain and meet your objectives and goals. The last thing that has to be done is a very thorough clinical examination, as well as a radiographical examination using the latest technologies to allow us to determine both the quality, quantity of bone, as well as all the vital structures to make this a very safe and predictable procedure. It's going to help us determine whether you can successfully have a dental implant. There are a few contraindications or reasons we would not be able to place a dental implant on a patient. That includes metabolic conditions such as diabetes, heavy smoking, certain medications that affect your bones, like we call those bisphosphonates, and a few other small risk factors. Thank you for watching our video today. If you have any questions, please call our office and we'll be happy to help out.